our school health update for September. Again, my name is John Banuelos. I am the one of two school health liaisons here at Pima County. I'm just going to go over a couple of items here on this month's meeting here on the next slide. Today's our agenda is going to be as follows. We have a couple of announcements here from the Pima County Health Department. We have our EPI update that will follow. Then we have the Idle-Free School and Walk and Roll programs presented today by Sky Siegel. And then Food Safety 101, Key Practices for Preventing Foodborne Illnesses, and that will be presented through our Food Safety Chefs program here. And then following, of course, we do have our Q&A. Here's our announcements today. So we do have the link here that you could sign up to our monthly newsletter for announcements, resources, and more. Of course, click that link. This is actually a clickable link here. Anybody on the update call can click that. And we'd love to have you sign up. We have great information here coming out, and you would get that monthly. Next slide, we'll go here. We're going to step right into our school health update from our epidemiology program, presented by Eliana Acosta-Zavala, and she will present now. Eliana? Just checking.
Hi, everyone. Sorry, I'm joining a little bit late. John, are we starting with EPI?
Yes, thank you so much. We are going to start with EPI. I could put the head of the slide right here, and we could start now.
Sounds great. Thank you. And so sorry again.
No problem.
Yep. My name is Eliana Costa Zavala, and I will cover a quick respiratory and heat use update. Next slide, please. We have here graphs that you are all very familiar with. For RSV, we tend to color that pink. And after about a month of having 0 RSV cases reported here in Pima County, we had a week with just 1 reported. And this is referring to the 3rd week in August. Our surveillance reporting is always a couple weeks lagged, but available on our website. People 15 to 64 years old are most affected by RSV. And that covers about 1/3 of our usual number of cases. However, kiddos 1 to 4 years old are the most affected age group. I just want to make sure that everybody knows that our usual respiratory season, it's towards the tail end. So you will see the next following graphs also on the same time period. And that tiny little speck on week 33 on the overall graph is referring to that 1 case that we had reported a couple of weeks ago, but we have maybe a month or a month and a half left before a new season starts, which this year falls on September 29th. Next slide, please. Also, not much to report on influenza. Very few cases, less than 7 for the last few weeks that have been reported for Pima County. Same time frame as RSV. And once again, about a month and a half until our current surveillance season ends. Next slide, please. For COVID-19, we tend to report on a yearly time frame. This will be changing for the next season. And we compare to what we've seen in the last 3 years. This is kind of a wonky graph to explain, just because that black line was severely affected by our case counts in 2020 and 2021, and has normalized a bit over the last year or so. For that same 2nd to 3rd week in August, we did see a little bit of an increase in COVID-19 cases. And this is a trend that has actually followed most of the summer. We have seen increased counts of COVID-19 cases, varying for about the last month and a half. We will continue our surveillance, and this is a great time to remind everyone, whether it's your staff or kiddos or families in your school communities, that most of our vaccination and immunization messaging should be gearing towards staying up to date for immunizations as applicable. For the current, or I'm sorry, not current, but upcoming season 2024-2025, most commercial pharmacies do already have the updated formulation for influenza and COVID-19 vaccination. And the current CDC recommendation recommends at least one dose of an updated formulation for this upcoming season for anybody who's over 6 months old. Both vaccines, flu and COVID-19, could be administered in the same visit or same day as needed. As far as RSV, there is slightly different recommendations, but if you have not seen our immunization page in the Pima County Health Department website, I can make sure to put this in the chat. For people who are insured, commercial vaccines have the availability. For people who are insured or uninsured or underinsured, our clinics will also have COVID-19 and influenza vaccines available, and all the information on availability and where to go to get it is available on our website. So I'll be sure to put that in the chat. Next slide, please. This is just a summary of wrapping up our current season. As I mentioned throughout the last couple of slides, RSV and COVID-19, not too much exciting happening over the last month and a half. COVID-19, some variation, and I cannot stress this enough, this is the right time over the next month to encourage our school staff, families, kiddos who are in school, to go and get those immunizations prior to the next season starting. Next slide, please. We always include this slide here to remind schools what reporting is mandatory in the state of Arizona. As far as these questions that are mentioned on the left side of the slide, who needs to report? School official. It can be a health aide, it could be a nurse, it could be a school administrator. Depends on the school, the size of the school, the district. What is reportable is mentioned on the list that's on the right and also linked within the slide. When they are sent out, this will be included. When to report, it's covered on the key in the bottom of that of this slide here. Depending on the disease, it could be a phone call, it could be something that could be faxed, for example, depending on the on what is suspected. And how to report, once again, if you go to the link on this slide, you will find in there two forms. One is a communicable disease report form, and the second is an outbreak report form. So include as much information as you're able on either one of those forms, and get in touch with us. Our phone number, I believe, is at the very end slide. But our epidemiology team has staff manning a phone. Or if you all fails, get in touch with the school support team. They know to forward communications to our epidemiology team. Next slide, please. If your school continues to see some COVID-19 illness, while it's not mandatory reporting in the state of Arizona, some schools do still choose to share out attendance reports and such. Our survey link for such reports has been updated, and I think this is my second time mentioning it, so I'll probably not mention it again. But if there's any issues with the survey, accessing it, we had some server issues about a week ago and heard from some schools that were unable to use it. But if you observe anything like that, please forward any issues to the email on the last slide for us, epi@pima.gov, and we'll do our best to resolve the issue. Next slide, please. I'm not going to linger on this one, just some resources for schools as usual. Next slide, please. I am covering the heat updates for another team member. We are in the middle, almost to the end of our current heat season, but our environmental team was able to put some slides together regarding heat and our youth populations. This is particularly important because kiddos are unable to regulate temperature, same as adults do. And also, kiddos may not have access to the information and resources to be able to protect themselves during extreme heat. And so, here are some recommendations to share out with school staff and support staff, administration staff, and even parents of things they can do to prevent heat-related illness, especially severe outcomes in our youth populations. Next slide, please. A little bit of an updated report on our current season. As of August 24th, we have not seen a change in the population affected by heat-related illness, and around 10% of school-aged children continue to make up our hospital visits for heat-related illness. There may be more cases that are underreported because they don't end up in the hospital. But so far this summer, and I think we reported on this about a month ago, this has stable. This has continued to be stable, and only one certified heat death of a minor has transpired here in Pima County. So that's good news. That has not. There has not been another report since. Next slide, please. Um, the next few slides will cover some specific recommendations for different subpopulations within school and youth age children. This one specifically is for athletes. So please share out the slides with your PE staff or administration staff within the schools. But as we know, athletes are sometimes pushing to the limit physically. So it can be a bit hard for them to regulate, as I've mentioned before, the temperature in their bodies. And these are some recommendations that we can keep in mind to reduce the incidence of heat illness in them. Next slide, please. Chronic health conditions can also cause extra stress in the body, and heat can just exacerbate and make that worse. Different health conditions, chronic health conditions like obesity, heart disease, and diabetes can also increase a person's risk of developing heat-related illnesses. And there is also some medications that can increase the risk of heat-related illnesses. I'm not going to cover all of them, but the link is there to view which medications this is specific to. Next slide, please. Specifically for asthma, this is a very nice infographic that could be shared out within school team or school population, just to have a very quick visual check for heat-related symptoms in different populations. The main difference between the two sides is one is more targeted towards children and the other one more targeted towards teens. But definitely something good to have handy to share out throughout the school. Next slide, please. This is also a very nice infographic. It can be found in the link that's within the slide here that mentions some of the different symptoms that can be seen at different stages of heat-related illness, starting from heat rash all the way to heat stroke, just to bring awareness to the wide gamma of physical demonstration that heat-related illness can have in a person. Next slide, please. I think we've shared this on here before, the daily heat risk tool. You can enter the county and zip code, and it will give you an outlook for the week of what to expect. The link is here, also at the bottom right of the slide. And it's also complementary to our ongoing heat surveillance, which is on the beat the heat .pima.gov or /pima.gov website, which is also publicly available. Next slide, please. Some additional resources that are more heat related are available on this slide. I am available to take any questions. If there is any, I think I saw something on the chat. Let me open that up. Is there a metric that schools can use and determine when to cancel practice, games, or outside time? I am trying to see. Is this related to heat-related illness? Nora?
Eliana, I believe it is. Well, that was when she mentioned that question. It was during the heat-related illness slides that you were presenting. But
Yes,
again,
okay. So I will put this site here. There is some extreme heat advisories, and they're available on our Beat the Heat website on the Pima County Health Department publicly available website. Actually, it's linked on this slide right here, where it says Beat the Heat. Days of extreme warnings are like seen on a red banner. And when those come around, you can either sign up for notifications, but they also come with recommendations such as reducing time outside. So definitely be on the lookout for the extreme heat warnings around the zip code. Another tool that you can use is what was linked a couple of slides ago, that daily heat risk tool. And if you put in the zip code, it will show you for your specific school what is recommended for that day and week. Hopefully that helps answer.
if there's no more questions, thank you so much, Eliana, for your presentation today. We're going to go on to the next slide, the next presenter. Again, we
Thank you.
also will have time at the very end to ask any additional questions. And also here we do have the contacting EPI program here. There's the email, the phone number as well. You can get directly to epidemiology and the web page and the reporting portal, which is very important too. So now we're going to go to our next presenter. It's going to be Idle Free Schools and the Walk and Roll programs. I'll pass it over to Sky.
Great. Can you hear me okay, everybody? I hope. Yay. Always
Yes.
love it when tech works. I'm Sky Siegel, and I am Community Engagement Coordinator with Pima County Department of Environmental Quality. And I am filling in for Natalie Shep, who is at an National Air Quality Conference in Minneapolis. And is just as a side note, I don't know if y'all happen to remember from the 90s, but a PDEQ used to be part of the health department. Next slide, please. So I'm going to be talking about the Idle Free Schools program and the Walk and Rule Schools program. They're closely aligned in their health goals. So what I am happy to share is that we are building on wonderful resources that EPA has. You might be very familiar, of course, with the Healthy School Environments literature and resources, but this Idle Free Schools focus, we're merging DEQ and EPA's literature and resources in a substantial resource pack, we're calling it. So what the focus is to encourage students and parents and teachers to be aware of idling as it emits highly concentrated cocktail of toxins and right in front of the school. And often the kids are sitting waiting for the parents, and the parents are lining up, and there's nitrogen oxides, carbon monoxide, carbon dioxide, PM 2.5 microns, and smaller particulate matter. And just as a side note, if you take one human hair and line up 20 PM 2.5 particles, that spans the width of one human hair. So the extra problem with the pollutants from vehicular emissions is it can actually go right into the bloodstream. So research is linking these concentrated pollutions from idling in front of schools. I mean, specific research talking about elementary schools. I have a recent paper on that, that it's linked to asthma, as you might all know, allergies, heart and lung diseases, cancers, and it also, this is one I was not aware of until I read this paper recently, of childhood leukemia connection. So there's also this awareness of having the parents just turn off their engines and be able to go to a cool spot or a shady spot. We'll talk about some of the options. But what we have in this powerful pack to enable teachers and students to work together is we have two 18 by 24-inch metal signs, and really emphasizing the young lungs at work, idle-free zones, and looking at alternatives on the school campuses of where else we can have the parents pull aside and be able to coordinate to be able to pick up their children safely. So what we're encouraging is student projects. And the beauty of it is we can meet lots of STEAM educational objectives with the climate resilience topics. So really an emphasis on community health and wellness, and transportation issues and science. And so we let the teachers know, hey, we have the pack, we have everything. You do not have to create anything because it's ready to go. We've got observation sheets. We've got a guide to how to analyze the data it's collected. We've got the pencils. We've got sample policies and letters to the parents, pledge forms, sample PowerPoint presentation ready to go to connect, and just how to create an event, and just doing what is feasible with the bandwidth that staff has. So this idea of students to become community scientists, I have a cool story about second graders at Innovation Academy. We had a MPH student from U of A, and he took a leadership role with guiding the second graders. And in the 6-week period of educating their parents, there was a 56% reduction in idling time when they were able to inform their parents of the damage that the idling emissions can do. I have one other note on this particular slide, and that is I just last Wednesday, talked to a New York activist, George Pakenham. And you may have heard about him. He created a documentary film called Idle Threat, Man on Emission. He's actually a U of A grad. And he connected with The Daily Show, and they created a 5-minute, pretty hilarious clip on a serious subject. But what it entailed was this empowerment of citizens to be able to collect 25% of the fine if they're able to report on the violators, because there has been a law. This is in New York City in 1971. There was a law put in place, so it's been illegal, but it hasn't been enforced. So there has been $47 million raised as citizen empowerment. But the note I wanted to say as it relates to idle-free schools is George is interested in helping us focus on youth and how he wants to come back to Tucson, do a showing of this documentary and impacts on public health, and encourage a movement on school campuses. So I want to make that note. Next slide, please. So this ties in very well with Walk and Roll program because it's all about protecting health of families in the big picture. So it starts September 30th through October 4th. The registration opened last Monday and it'll go through September 25th. So we've got a few weeks here to work with to get folks signed up. And this is there's 21 schools signed up already in a week. So it's fabulous. We're hoping for 60. When we first started, it was 21 schools actually the first year in 2021. And we've got 2021 going. So we're really excited that people are happy to participate. So we are really zooming in on people-powered active transportation. So for physical health, but also to bring the awareness of reducing vehicle trips and use there are all kinds of fun ways to get to school. We just got to focus on it being a safe and part of safe routes to school concepts, the scootering, the skipping, rollerblading, and just a walking school bus, bicycling, all those different ways. So we're really looking at our key goals to improve student health, reduce congestion, especially, and of course, improve air quality on school campuses and neighborhoods, nearby neighborhoods, and reducing the greenhouse gas emissions from motor vehicles near schools. So what we provide is another wonderful a resource pack. We've got 3 feet by 9 foot banners. And as you can see, we do have scooters that are actually yay for the health department. The bicycle pedestrian program, I've been working with Tina Flores for many years and cooperating in that. So, also, of course, flyers. We give little posters to share, walk and roll stickers, and be safe, be seen, highly reflective stickers as well, and participation tickets for the giveaway, because each school will have a scooter to give away. And if it's an middle school or a high school, we can swap that out for a bike pannier or some other item that will encouragement item for that. So that is the highlights, really zooming in and improving school built environments for Walk and Roll to School and Idle Free Schools program. And just as a side note, Idle Free Schools registration is open year round, anytime. Walk and Roll, we do have this focus on the second, the dates for registration. It opened August 26th, ends on September 25th, because I've got to get some time to get everybody the resource packs. But that the actual event is the first week in October. The national event is the second week, but that's going to not jive with our fall breaks with school. So we're going to just go ahead and do it the first week. So thank you very much for your patience. I'm happy to answer questions as you need.
Thank you so much, Sky. That was a wonderful presentation. Anybody can put in their questions in the chat. Thank you again. We're going to go on to our next presenter, and it will be Food Safety 101, Key Practices for Preventing Foodborne Illnesses. We have Enrique on there. Take it away, please.
Hi, everyone. My name is Enrique Zarate. I'm with Consumer Health and Food Safety, and I'm a program coordinator and one of the key persons now for outreach programs here in Consumer Health and Food Safety. Today, we're really just talking about some general points for food safety in preventing foodborne illness, whether you work with the food or if you're someone that kind of walks through the kitchen every now and then. Just having an idea of some of these key practices is always good to know. If you see something wrong, you can say something to maybe administration or maybe report it to the lunch staff. It may be useful in those cases. We can go ahead to the next slide. So food poisoning burden. CDC estimates 1 in 6 people every year get sick. A lot of the times this is an estimate because it most of the time goes undiagnosed. Of that, 128,000 are hospitalized and 3,000 die from foodborne illness each year. So consumer health and food safety's role is really in preventing this, right? Preventing illness. So we do audits of the school food services, so that way we can provide direct feedback to the schools about where they might be able to make improvements, or, you know, when things are in the day-to-day moving forward, a lot of the times things just become monotonous. And so sometimes it's good to have a third party there that can really point out if there's any gaps in the system. Next slide, please. So last time we talked about norovirus. Again, norovirus is the causes the most illnesses, and it's the leading cause of foodborne deaths. And this is the case because it's the most contagious out of all of them. Just putting the slide here because we're coming into our norovirus tends to be most active from November to April. So it's kind of just a reminder to keep monitoring for that. Next slide, please. So anyone can get foodborne illness, but in this case, we're really focusing on the highly susceptible populations for foodborne illness because they're the most at risk. Here for this group, we have this age group of younger than 5 years of age. And so that's for any of the schools that may have Head Start programs, daycares, anywhere where there may be more of that population. But again, anyone can get foodborne illness, and we'll talk about a few ways to possibly help identify those. One thing to list here, or one thing to note, because we kind of mentioned this with norovirus, but keeping logs when people are getting sick with any kind of gastrointestinal illness, it's probably important to keep in some cases when you can, right? Tracking food history over the last 3 days may help point out any kind of common links of illness. So that way, if you do have a higher population of people getting sick at the school, sometimes food history may identify some common places where maybe it may be a source. So keep that in mind as well. Next slide, please. So these are going to be the risk factors that we're focusing on. They're the ones that we focus on when we're doing inspections. We're going to go into depth for each of these, but we have improper cooking temps, improper hot and cold holding temperatures, poor employee health and hygiene, dirty and or contaminated utensils or equipment, and food from unsafe sources. So we'll go ahead and start with the next one, which is going to be improper cooking temps. Next slide, please. So improper cooking temperatures, many schools aren't usually cooking from raw, but in the cases that they do, it is important to make sure that they're reaching their proper cooking temperature. Now, one thing to note for schools is FDA and food code may start moving. They've really highlighted recently the importance of reheating food correctly, because there are some cases where a lot of schools will instead use foods that have already been cooked and cooled and frozen. So FDA and the Conference for Food Protection are actually starting to really talk or emphasize the importance of reheating temperatures. A lot of the times food comes packaged with specific instructions, and so it's really important to follow those reheating instructions as well, just because there have been some outbreaks in the cases of foods that may not be reheated properly as well. So that may be coming soon, but I wanted to insert that here because I know in a lot of schools they may be focused a little bit more on reheat temperatures rather than improper cooking temps. Next slide, please. Improper hot holding and cold holding temperatures, we really just want to try and make sure things are being refrigerated or they're being hot held. In a lot of cases when school service does happen, you may see food that is kind of out on the line, or it may not be cold held or hot held, and that's because they're using time as a control instead. So the food may only actually be there to be used in a certain time period. But ideally, most of the time, they'll be either hot hold or cold held. Next slide, please. Poor employee health and hygiene is probably one of the more important items when it comes to food service and food safety. We really spend a lot of time watching behaviors, checking to see how people are moving around. But it's also making sure that employees that are sick are not working, right? Especially those that are working with food, just because they're literally working with the items that people will be ingesting. So we just wanted to highlight that here. Again, people that should not be reporting to work are those with a sore throat and fever, those with diarrhea, those with any kind of infected or pus-filled wounds, if they're vomiting, or if they have jaundice. Again, many schools may have a written policy for this. If you don't, you may want to have one, but it's just really that the employees will let you know when they are sick and will not report to work when they are sick. And I know that's hard sometimes because some people don't want to miss work, but again, you want to do your best that you can to make sure people that are sick are not working. Next slide, please. On that same note, right, we do have people that are concerned with HIPAA, but HIPAA does not prevent managers from asking employees if they're sick. A lot of what came out of COVID as well is a lot of restaurants and places actually implemented people checking in on the way into work, right? So in some places they will ask them every day, do you have any of these illnesses? No, perfect, thank you for checking in with us. And depending on your current setup now, some of the districts may have something already in place. If you're a smaller school, you may want to think about possibly having something in place just for checking, or if it's ever suspected, right? Because if you see someone that looks like they're sick and they're still reporting to work, you can always ask or try to talk to that person to make sure that they are not sick. Next slide, please. Again, training food employees with good practice is going to be the most important here. It was kind of the same with norovirus, right? Reminding people to wash their hands often, preventing bare hand contact. So a lot of the times this is using gloves, tongs, any way that they can't touch the food directly with their bare hands. A main point here, a lot of the time, is that in some schools, people think that gloves mean you don't have to wash your hands at all. Right, so a lot of the times we may go to a place and some people may just keep the same gloves on the whole time while doing everything. But anytime they change task, they really should be removing the gloves, washing their hands before they don on new gloves as well. Next slide, please. Contaminated utensils and equipment. This is also another area where we see an issue sometimes. So all of the food equipment should be washed properly or the sanitizer be used correctly. Now, in some places where they have maybe dish machines, sometimes the dispensers that dispense detergent, they don't do it correctly every once in a while. And a lot of schools do have logs in place where they may check this in the morning or in the afternoon or at night before closing or early evening. But it is someplace that you may want to check more often depending on how old machines are, or you may want to review your practice on how often it's done. Again, a lot of the times there's a third party, and I say that in terms of like maybe the district has someone come in and kind of look to make sure things are working correctly, or the manager themselves may be checking this daily. Every once in a while though, for some people just get so into the routine that sometimes it just becomes I just need to write this on here. So be sure they're checking that as well, just to make sure items are getting cleaned and sanitized properly. Next slide, please. Food from unsafe sources. This one, a lot of the times, a lot of schools have approved suppliers already. Where this really comes into play at schools is if there maybe is a party or something happening, and that isn't always the case, but again, it's just when students are starting to ingest food where we don't know where it came from, right? So a lot of the times, if people are consuming food, it should be from a safe source. Next slide, please. I think that's all I have. I don't know how many of the people on this call are active with being able to see their inspections. Like I said, usually that may go up to the district for some. If the schools are smaller, sometimes it goes to the principal. But there's actually a disclosure site that we have, and I'll post that in the chat, where people can really go, and it's the public website, people can go and check how they've been doing on inspections or see what the issues have been that have been noted. A lot of the times we try to get correction on site when we're there. In some cases, if it's a smaller thing, that may be something that needs to be corrected within a time frame. But I'll go ahead and put that site in the chat. That way people have access to it if they'd like. And if that's everything, I can take any questions.
All right. Thank you so much, Enrique, for that presentation. It was very good, very informative. And again, if there's any questions, you can put them in the chat here. Looks like Enrique did provide information there. So at this time, we're at 1:40. If anybody has any questions at all the presentations, you can please put them in the chat. Again, you can contact us here at the information here below. You can see the Healthy Schools website. That is also our direct line. And then if you have any questions, you can directly email us at theschoolsupport@pima.gov. So I'm going to leave the chat and this open here. That's all the presentations I do have today for the September School Health Update. Again, I do thank everybody for joining us today, and we also have our next one coming up, and also the first week of October. Thank you. So again, if you want to log off, you may. I will stay on here and wait for any questions. Thank you, Nora. Thank you also, Michael Webb here to thanks. I want to thank you all the school partners and attendance today. Any members of your team that should be here, please connect them with us at the school support at pima.gov. Thanks again, everybody who did join. We really appreciate this. I'm going to shut down here at 1:45. I appreciate your time.
John, it looks like we have a question from Sandra about cough drops. Sandra, if you would like to put your question in the chat, we can do our best to answer that. And if we don't have an answer immediately, we can definitely reach out to you to try to get you the correct information.
Thank you, Michael. Sandra, what question about cough drops do you have? I could report out. Okay, I see the question. Eliana, is Eliana still on the call? Doesn't look like she is. So, Sandra, the best thing I can do is, can I get back to you with that question regarding cough drops to students in your health office?
Yeah, John, I think let's discuss as a team.
Sure.
And I think that we can probably tap into our clinical services leadership to get some guidance on that. We also have some information I think we can review as far as stock medication permissions, things related to albuterol or epinephrine that we usually deal with. But my inclination is that oftentimes that's going to be a school site or district specific policy. But we can certainly look at information internally and get back to you. Okay, Sandra. Sandra, can you do us a favor and just make sure you put your email in the chat for us, and then John will follow up.
Sounds like a plan. Thank you, Michael and Sandra.
Thank you.
All right, I have that email. It is now 1:45. Again, thank you for everybody for joining. I will be ending the meeting and we'll see you next month.